This week we'll be talking about jaw pain, otherwise known as temporomandibular disorders, or TMD for short. My name's Brent Dodge. I'm physical therapist and owner of Alpine Physical Therapy. Our South Clinic located here in the Peak Health and Wellness Centers, where I'm performing most of the jaw work that we do at Alpine Physical Therapy. Now, you may hear the term TMD, and as I mentioned, that's temporomandibular disorder for short, or you may have heard of TMJ. That would be temporomandibular joint problems or dysfunction. The newer term is TMD. And our areas of specialty include all aspects of orthopedic medicine. My background as an orthopedic certified specialist and certified manual physical therapist have allowed me to pursue advanced training in treating jaw pain. We treat patients that come from a variety of orthopedics, dentistry. We work closely with area doctors to help our patients with TMD or jaw pain. Not everything that is jaw pain is truly a TMD. In fact, as I'm going to express today, there are many causes of jaw pain that are not specifically and directly involving the temporomandibular joint. That joint, which is formed like a round knob within a socket on either side of the cranium where the mandible meets the cranium. That is the temporomandibular joint. Oftentimes when people talk about jaw pain, they may reference the TMJ, the temporomandibular joint, but that cause may be from something other than the jaw itself. One of the areas that we're seeing a lot of results in is treating problems where there's an underlying stress or tension problem that's creating sensations of tightness within the jaw. And in fact, you'll be interested to know that many of the orthopedic patients with whom we work actually present with tension involving this area of the face. And oftentimes we'll get results in treating other parts of the body, such as the shoulder, the upper back, even low back pain, by addressing what's going on this side or this side of the face, depending on where they're feeling the tightness, either the right or left jaw. One of the techniques that we're using with this is called pain reflex release technique. This is a technique that is specifically addressing the cranial nerve system. Why is that important? Because the cranial nerves are actually within the cranium, in the back part of the brain, and there's one nerve of the 12 cranial nerves that directly provides motor activity to the jaw and the muscles of the jaw. That's called the trigeminal nerve. And the trigeminal nerve also has a large sensory nerve cell body along the side of the jaw, and through the face it has 3 branches that signal sensation through the jaw, the mid-face, and the frontal area of the head. This is an important nerve because oftentimes when there's overactivity in this nerve, that tells these muscles to begin to work hard. And oftentimes at night people will end up grinding their teeth, what we call bruxism, and it's an overactivity of the trigeminal nerve. Now, there are other causes that play into true TMD, such as degenerative changes that can occur within the condyle of the joint itself. And I mentioned that it's somewhat like a knob and a socket, but there's also a disc between the joint along the side of the face that can oftentimes become either displaced or can actually become degenerative. And in both of those cases, we use manual therapy techniques to help take pressure off the disc to hopefully and theoretically begin to move the disc back into place if in fact it's been misplaced or displaced in this case. And we also do very specific mobilizations to the jaw area to help bring in nutrition and lubrication to the disc itself. And so there's a variety of problems that can occur within the joint. Again, some are true TMD or temporomandibular disorders. Some can be classified more as jaw pain, which are addressed a little bit differently. Now, there's a larger scope of care that goes along with physical therapy for people with jaw pain. And this involves specific treatments to the areas of the upper neck, and some physical therapists are schooled in advanced manipulative which means an adjustment, if you will, to those upper joints, as well as mobilization, which is a gentle movement within the joint to help restore normal alignment, to help with healing, health of the joint. Along with that, we are working specifically with patients to improve upright posture. We look specifically at breathing patterns. We are going to work on reducing muscle tension through relaxation techniques. We at Alpine are using laser technology, which is very helpful for difficult pain situations and has been very helpful for treating TMD and other forms of jaw pain. We also use ultrasound treatment, and that's a fairly traditional physical therapy modality for treating various types of jaw pain. An overriding scope of care not only includes posture, but it's going to include a strengthening program for the upper back and as well strengthening for the deep neck flexor muscles to provide good stability for the upper back and for the neck itself to provide stability for the head and give optimal posture for the jaw joints. Should you be experiencing any jaw pain or have been told by your dentist or orthopedist that you have true TMD, Alpine is a place where we can oftentimes tailor a program based on the specific request of the physician to design that program that would help you in conjunction with the work that you're doing with your physician. And so if at any time you need information about jaw pain, be sure to visit our website, www.alpineptmissoula.com, or feel free to call our physical therapists at Alpine Physical Therapy. I'd like to introduce just a couple of the ways that we use home exercises as part of treating jaw pain. This involves good upright posture, so I'm going to have you sit up tall, not ridiculously tall. You're going to bring your chin back just slightly, and I want your tongue resting behind the top row of teeth in a very relaxed manner. Now what I'm going to have you do is open your mouth about a finger's width, and what we're going to do is we're going to be moving the jaw, or attempting to move the jaw, in one of 8 positions while holding with your muscles. We call this an isometric contraction because there's no movement that occurs. We're simply trying to use good upright upper body posture while placing a force through the muscles that would help stabilize the temporomandibular joint. Now these 8 moves would be, for example, don't let me push you to one side, don't let me pull back to this side, don't let me push up, don't let me push down, and then the 2 angles, an angled movement up, an angled movement down, an angled movement to the opposite direction up, and an angled movement down from that direction. So we get 8 movements, and you're holding these for 6 seconds, and you're going to do 6 in each position, what we call a 6x6 exercise. Now the isometric exercise actually advances to what we call an isotonic exercise, in which you're going to be moving with a light resistance using your hand, where you're going to open against resistance, and then allow a closing against resistance. And then again, you're going to work in these 8 positions of moving through these ranges of movement while holding very steady as you stabilize through a movement, in this case, what we call an isotonic exercise. The other exercise I like to do is to actually have you watch yourself in a mirror and watch your mouth open, and make sure you can even put a straight edge like a ruler up and see that you are opening your mouth with perfect alignment. And you're going to do that in good upright posture. As you open and close, you're following that nice alignment.